Welcome, welcome. Yeah, again, my name is Kai Wen Chen. I am an assistant professor in the department. So yeah, I am the co-chair for the MHA admission committee. So yeah, Dr. Lu has already provided lots of details in terms of where to apply, how to apply, and she also provided lots of information about why you need to choose GSU MHA program. So what I would like to add, it's I feel GSU, the MHA program is overly undervalued. Well, again, this is an accredited program, can be accredited. It's relatively affordable compared to other MHA programs in Chicago area, and we have great location. So yeah, if you haven't applied, I encourage you to apply soon. We already started reviewing the applications, and the deadline is November 15th. So, and I also would like to remind you guys that, well, you really need to have all the documents ready. So a lot of you apply, but the profile is not completed. So we are not gonna review the incomplete profile. So if you haven't completed your profile, well, we did send out the reminders in terms of what material you need to submit, what material is missing. So yeah, ensure that you have you have the complete application, and yeah, that's it. So so for the spring 2021, we already reviewed the application, and the deadline is coming up. So yeah, act fast.
Thank you, Dr. Chen. And that's a very good point Dr. Chen just made. You have to have a completed application so that the committee will move on to the committee to review. Otherwise, your application will not be reviewed. The elements I mentioned earlier should be contained in your application package. And Dr. Chen and Dr. Grubner have been sending out the reminder asking you, you don't have a reference letter or your transcript is not certified, and ask you to submit so that we can move on, we can process, and let you know the decision as early as possible. So that's a very good point. I'm not sure Laura is here. Laurie Tyson, are you here? Okay, I think she's now here. Laura Tyson is our adjunct professor, and she used to be our MHA student. Now she's an operation director at Riverside Hospital, healthcare. So I wish she's here. She were here to share her experience with our program. But since she's not here, may I ask Dr. Karen Russell to share your experience with our MHA program as adjunct professor. And Dr. Russell used to be our faculty member, but she moved to Indiana, but she still keeps in touch with the students and teach for our programs. And she also serves on advisory board.
Thank you, Dr. Lu. Can you hear me?
Yes, hear you very well.
Okay, I want to add some wonderful things about GSU. For those of you online, I actually worked for GSU for 5 years, and I taught in both the undergrad and the graduate program. Since I've left GSU, I have worked for a Big Ten university and also a very large university in the state of Michigan. And I'm here to tell you, you have a real gem in GSU. Number one, I just want you to know that the MHA program at GSU is much more rounded. One of the things the faculty do here is they teach you health care organizations. In a lot of MHA programs, they focus just on acute care. And with 11,000 baby boomers retiring every day, we're not into institutionalized care. What we're looking for is healthcare more in the surroundings in the community. That's the beauty of GSU's program. It's not just acute care. It is health care organizations. In addition to that, when I taught at GSU, and actually Lori Tyson was a student of mine, one of the things that I have always told the students is that a bachelor's is only a stepping stone to a master's. I worked in healthcare 35 years and went all the way up the chain. And when I got my master's degree, guess what happened? I got promoted, and truly my income went way up. So remember this, if you have a bachelor's, that may be an entry point, but you'll never end up in the C-suite without a master's. And what they look for is accredited programs. In addition to that, if you do start working, some healthcare organizations do have tuition reimbursement, and they will not pay for a program that is not accredited. The other thing I wanted to mention was this, is that you are so fortunate you're in Chicago. You have great faculty. I know them. I do keep up with them. And the other thing that you have is a student organization at GSU that is very much involved with the American College of Healthcare Executives. And the student track is there. You get to actually, if you get selected to go, you're among 5,000 healthcare executives that are from not only the United States, but globally. They also have an early careers program, but SHEMA, which is the Student Healthcare Management Association at GSU, is exceptional. And that gives you opportunities that if you were in Indiana or in Michigan, you would not have. So I want to just encourage you this. Number one, GSU is a very well-rounded program, very well, compared to other programs in your nearby states. Number two, the other thing, it's affordable. When I look at GSU's tuition, and I know what the master's tuition is elsewhere, let me tell you, master's level starts at $750 to $800 at other universities. The other thing that I just really wanted to mention is this, is that you have a great program and it's competency based, which Dr. Liu mentioned, and they're certainly looking for that. So with that, I just really want to encourage you to apply. It's a great program, and you'll get a great education. And one more thing quickly, the one thing that GSU really offers that's wonderful is the 120 hours. Students always used to say to me, how do I get my foot in the door? How do I get my foot in the door? Because they'll get this degree and it's like they can't get into healthcare. One of the great things about GSU's program is that you have 120 hours working in a healthcare institution. Number one, that goes on your resume. So you've already got a foot in the door, because when employers look at you, oh, well, you have some experience. And number two, at these institutions, when you go in, a lot of students, they look at how talented and bright you are. And guess what? You become candidates for open positions there. So just want to sing my accolades to the GSU program, and I can say that because I've worked at 3 universities, all having programs. You want an accredited program, and I can attest for class sizes at GSU, you will get to know your professors there, and you will not be a number, and you will not be in a lecture hall with 100 students. That's it.
Thank you very much, Dr. Russell. Dr. Russell has more than 30 years of working experience in the industry, and she brought her experience to the classrooms. She also used to be our student organization supervisor, and for that year, our student organization got an award to be the best student organization at GSU. So thank you so much, Dr. Russell. And I just say Barbara Johnson, who is our Miss Johnson, who is one of the advisory board member, and also she's the SHP. So Barbara, would you like to say something?
I need to. Can you hear me okay?
Oh, okay. Go ahead. I think it's a little bit static, but try it again.
Okay.
Oh, it's a little better. Go ahead.
Okay, welcome everybody. I'm so glad you're considering us. The program is very unique, and I think what's really special about us is that you get personal involvement and engagement, so that when you complete the program, you've got advisory board and staff and faculty who have real world experience and can help and guide you and also introduce you to opportunities. So if you need our help, we're here and we'd be delighted to see you next semester.
Thank you so much, Barbara. I have students and alumni here. The first one is Chupina Patel, who is our alumni when she was here as a student in the master's program. She received the Outstanding Student of the Year. And now she works and lives in North Carolina. So Chupina, would you like to say a few words to our students?
Sure. First of all, I'm so glad to see you, Dr. Lu. It's been
Oh,
a
thanks.
long time.
It's been a long time.
Yes. Um, well, I, as Dr. Lu said, my name is Dupina Patel. I work as business analyst at Novant Health, and I live in Charlotte, North Carolina. I graduated GSU in 2015. And for me, what made a difference is being an international student, the cost of the program made a huge difference for me. And GSU had, as everyone said, the overall program is so good. It's affordable. It was the cheapest MHA program. Accreditation wise, you get all the classes and subjects that are being offered at other institutions at a higher rate. So for me, that made a huge difference. And when I joined, it provided me a solid foundation to take on the challenges the healthcare field has to offer after graduation. And it was a perfect place for me to flourish in both my studies and lifelong friendships. I worked as research assistant while I was studying MHA, and I learned so many software programs like SAS and SPSS while assisting my professors. And I also had a lot of help while looking for my internships for my capstone project. And honestly, the professors of healthcare department, they have the best professors you would have. And the amount of support you get is amazing. The culture at GSU is very supportive, and it's Chicago. Everything related to healthcare is right near there in downtown Chicago. And up, along with the course curriculum, we also have the Lean Six Sigma Green Belt, and it really helped me in getting my job secure. And I still get challenges with my Lean Six Sigma projects here. So that certification was very helpful. And I'm on LinkedIn if anyone wants to ask any more questions. Any international students have any questions, you can contact me, because I know it could be a struggle as an immigrant, but I think GSU was very helpful for me in that case too.
Thank you, Trupina. Oh, I want to mention this. Trupina is Green Belt certified. When she was a student here, we offer a course that provides the preparation for Green Belt certification. Green Belt certification is for anyone who wish to work in a healthcare quality improvement related function. And Trupina is the very first generation of a student to receive the Green Belt certification. And congratulations, that was 5 years ago.
Yes. So, yeah, we started with our batch and it was new, but it was very helpful for me because whenever I would give interviews, there were baby boomers and old people who didn't had any idea, but they really wanted to implement a lot of Lean Six Sigma and A3 projects. And that's where I was able to put myself forward and saying that, I have this certification and I have experience in using it. So yeah, that was very helpful.
Thank you. Thank you again, Japina. Okay, I have the next one is supposed to be our current student. I'm actually a candidate, but also our program assistant, graduate assistant. But unfortunately, she had a doctor's appointment, so she's now here. But in her place, we have our current MHA candidate, Ashvi. Are you here, Ashvi? Okay, I did not hear her. Let's see if she's here. Ashvi, are you here?
I don't see her name, but there are a couple callers that just have numbers, so I don't know if she may be one of these callers.
Okay, Ashvi, if it's you,
You can raise her hand, maybe.
raise your hand so Laura can see it. Do I have any current student here? Even you are not the candidate yet. Do I have anyone who is current student? And if you are, raise your hand. Okay, I don't think we probably lost her. It's okay. So we have about 20 minutes for the questions, exactly 20 minutes. Am I right? And for questions, if you do you have any questions sent to you?
Oh, yes.
Ashvi is right here. Thank you, Ashvi. Do you want
Can you guys hear me now?
Yes.
Yes, I'm sorry.
I was one of the callers, but I had unmuted. I still wasn't able to talk, but I'm glad we are here and you guys can hear me.
Good. Would you like to share with our potential students your experience, because you are a current student and a candidate, and with our students, your experience?
Yes, absolutely. That would be my pleasure. So yes, hello everyone. My name is Ashvi Patel. I have finished my MHA coursework and I am currently finishing up my practicum with Rosen Community Hospital. I chose to do my MHA with Governor State University because it is CAMI accredited, it is affordable as everyone mentioned, and trust me, it is very, very affordable. And the university is just, 30 minutes away from my house. I want to say that over the last 3 years of studying at Governor State University, I have learned a lot. And let me tell you all, I started my undergraduate degree was in pre-med biology. So coming from a clinical background into administration was a little rough in the beginning, but the professors here have helped me so much. All of the professors here at Governor State are fabulous. I have had classes with Dr. Liu, Dr. Munz, Dr. Angel, Dr. Pittman, and many more. And all of them are amazing. They were always available for me. And I cannot express, they have helped me guide me in a proper direction at every point of my degree. So my advice to you all is to utilize every single resources that we have here at Governor State University. I've personally benefited a lot, asking for help from professors, from using Writing Center, especially when I had, big projects and papers. I would also encourage you all to join the Student Healthcare Association, which is the SHIMA. It will help you guys to stay connected with your peers. And it is also a good networking opportunity, as Dr. Russell mentioned earlier. And lastly, remember to just stay on top of your game. And I wish you all the very best for successful completion of MHA program here at Governor State University.
Oh, thank you, Ashvi. Ashvi is one of our outstanding students, and she's graduating. So congratulations, Ashvi.
Thank you.